Some people with a Pakistani passport, when they go to the States with a J1 or H1 visa and they finish their residency.
Who have switched fields of residency in the middle.
Oh.
You know, I've had people who have done family medicine, who have gone to internal medicine, and in the middle, they're like, I want to go into surgery.
You're saying basically what you're saying is that the USMLE, they want more hands-on and more practical doctors instead of bookworms.
Practice with as many exams as you can. Take 1,000 practice exams. It doesn't matter what score you. Assalamu alaikum. My name is Dr. Hamza Farooq and welcome to another segment of Excemy R. Wait.
This is my video. What are you on about?
My bad.
Assalamu alaikum. My name is Munsoor Ahmed Khan. I am a second-year MBBS student at Dow International Medical College. Today I'm joined here with Dr. Hamza Farooq, and today we're going to be discussing about the United States Medical Licensing Examination, otherwise known as the USMLE. Dr. Hamza, can you tell me what is the USMLE?
Well, first of all, I want to thank you for having me here today. The USMLE, also known as the United States Medical License Examination, is a three-step examination that once IMG and AMGs have graduated, they need to be able to take these examinations in order to practice in the United States.
Okay, so do you know the registration process of the USMLE?
I'm glad you asked me that because that's a very common question. So for IMGs, because I was in IMG, let me talk you through the process that I had to take. We went through a site called ecfmg.org. On there, there's a basic list of things that you need. One is you apply for a USMLE identification number, also known as an ECFMG identification number. Once you've had that identification number, which I think once you fill out the form, it becomes like, it gives you in like 5 or 6 days, Once you've had that, then you can certainly apply for certification of ECFMG. And from that site, it will tell you like when to take the USMLE, if you plan to take step 2 before step 1 or step 1 before step 2. On there, everything is listed out in order. And if you want to catch up on more updates on that, then you can go to also USMLE.org.
Okay, so the USMLE, how many exams does the USMLE actually contain?
So it contains, it's a 3-step examination. You have USMLE Step 1, which tests your basic sciences. You have USMLE Step 2, CK, which now I'm hearing about is that CS has been canceled due to COVID, and it's been on their new regulation bulletin board as well. Step 2 CK, it tests your clinical knowledge, everything you've learned from either third year of medical school all the way to final year of medical school. And step 3 is how to have a general patient care, in which, you have a general board of practitioners, and they will test you on your knowledge of how, in order to take steps like history taking, diagnosis, that is all listed in step 3.
All right, so can you tell me how did you prepare for these steps?
Okay, let me first talk about step 1. So in step 1, it was basic sciences. First of all, I want to mention that it is very different for every student out there. Some people do it systematically, which they will start from like cardiovascular, respiratory, GI, and some people do it like subject-wise, which they will do it by biochemistry, genetics, pathology, physiology. So what I did is I went by first subject-wise. When I was taking my step 1, I had a dedication period. Another thing is dedication period is very different for everyone. If you're an American medical graduate, they give you a dedication period of 1 month, 4 weeks, in which basically you've been studying for your 2 years of medical school life, and now this is the time that you don't do anything else but study for step 1. For foreign medical graduates, it's very different. They don't give us a time of when to take the step. We have to make our own time for it. So what I had personally was I studied for 6 months on the USMLE Step 1. Some people will take a year, some people will take 4 months. You have to take it when you are ready at the first most. So in that time, when I had subject-wise, right? So throughout my calendar, the number one thing I did was I took a practice exam to tell me what my score is and where I need to focus on. After I took my practice exam and got my first score, I would make a calendar. Calendar and organization is very important. You can either lead through the calendar But don't like panic if like, oh, you missed one day of studying. Where am I gonna go afterwards? You know, you can always
Yeah.
catch up on that. So what I would do is subject wise, like I had 3 days of cardiovascular, right? So I would study the physiology, pathology, and all of genetic wise through that, right? I would take that throughout the week. I would have one resting day. Remember, you're studying for STEP. You need to have a break. We're not made of machines out here. We need to have that break. You know, Sunday would be my break, and I would either take 1 or 2 practice exams.
Okay. So, and when you were doing your step one, can you tell me what other resources that you used while preparing for it?
I'm glad you asked me that. The resources I used is first of all, first aid. Think of it like that is your religious book out there for step one. You know, first aid is important. Read your notes from that. Make sure you understand that book in and out. After that, I would recommend is going online, having a subscription for UWorld. UWorld is like when people come to me and ask me about step one, I tell them the number one thing you should do is practice with as many exams as you can. Take 1,000 practice exams. It doesn't matter what score you get. Eventually, you will get better. The other thing that I would think is Patho by Dr. Sattar, I think. Pathoma videos are very helpful during step one. Their book is a very generalized view. It gives you a high yield option. I also used Golgin at that time. Board review series books for anatomy, pathology, I also used that, and they were very helpful in description wise and summary, because you have learned everything you wanted to do during your first 2 years of medical school.
Yeah.
Now you are reviewing, you know?
All right.
So you don't want to stress yourself out that much, even though it is the time to stress yourself out. You want to take it at when you're comfortable as possible.
Okay. So, well, what are how much do these exams cost? Like, is there a different cost for American medical graduates and for IMGs, or is it the same?
There is a different cost, and I'll tell you why. The first, I think the basic cost what I was taking with was around like $970. But for people that I knew who took it out of the country, because you can take you don't have to be in the United States to take step one and step two. You have to be in the United States when you plan to take step three.
Okay.
So you can take the step one and step two exams in different countries, which they have an international surcharge of what they are, and you can find that online at ecfmg.org as well.
Okay, so well, the USMLE, it's not easy. It is pretty difficult as well. So the thing is, not everyone is able to clear their exams on their first try. So how many times can a person retake this exam before they're not allowed to take it anymore?
Okay, for step one and step two, CK, the thing is that you are allowed, in a 12-month period, you are allowed 3 attempts. But your maximum attempt is 6. But the tricky part is when you take your 4th or your subsequent exam, from the first time you took the exam, let's say I took the exam 2 years, like 1 year ago, right?
Yeah.
I need a 12-month period before I can take my 4th exam.
Okay.
But from the third exam that I took, it's a 6-month period between the 3rd and the 4th.
Okay.
And that's the same thing for CK as well.
For CK as well. Okay. So would you tell me, well, at what years of your medical school did you give these exams?
Well, based on the ECFMG guidelines, first of all, you can only take step one after you have done your 2 years of medical school and are currently enrolled. So I took it when I was in about my 3rd year of medical school.
Okay.
And I was unsure of that. But, you know, that's the tricky part. You're never ready for these exams.
Oh, yeah, man.
You just have to take it. I mean, once you feel like you've done everything, you just have to be confident and take the exam.
All right.
And on top of that is that when I took my step 2 CK exam, that was mostly towards the end when I felt like I've had clinical trainings. You know, take it when you've been exposed to patient care, you know, when you're starting history taking, when you're doing clinical skills, that's when you should take your clinical knowledge, when you're starting to learn medicine, surgery, gynecology, and pediatrics.
Yeah. Okay, so the thing is, when people do take these exams, they're then concerned that when are they going to receive their results for it. So could you tell me when did you receive your step 1 and step 2 CK results?
So the thing is that you get your results basically in 3 or 4 weeks for step 1 and step 2, but that may vary different on conditions. Like we all know that COVID is going on.
Yeah, that is true.
Last year and probably this year, that some people who took it during that time, they received their results way later than when they took it. Maybe it came back, like I've heard, about a month later, or 2 months later. So it was a very tough time back then.
Well, recently the USMLE has changed its step one, the results of the step one from a score-based result to a pass-fail score. And so, how do you think this is going to impact the IMGs trying to get residencies in the United States?
That is a tough question, I'll tell you that, because there are different views on that.
Yeah.
I'll tell you my view. My view is, this is my view. When I was taking step one, I was panicking, my palms were sweaty, my heartbeats, palpitations. I would not talk to anyone during that time. It was a very stressful period for me. But the thing that I tell people now is that because it's become a pass or fail, it's probably a good thing. Because what I've heard from other residents is that they're looking for doctors that are not being like book read. They're looking for doctors who know their clinical skills, who know on top of their knowledge that, okay, if a patient is here, how do you handle that patient? That's why step 2, CK, they've promoted that even further. So what I would recommend is now that they're going to look at step 1 as like when you're taking your research and your electives, when you're putting it on your CV, that's where step 1 will be. The most important thing they'll probably look at now is step 2, CK.
Okay.
On that. So I would be like, okay, if that this period that at the end of this year, it's going to end soon, right?
Yeah.
And then they're going to change it to pass or fail. If people are worried about taking it during the end of this year, I would probably recommend them to take it afterwards and not to stress about it.
Okay. So, well, you're saying basically what you're saying is that the USMLE, they want more hands-on and more practical doctors instead of bookworms.
Exactly.
Exactly. So that's why they're putting their focus more on step 2 CK. But recently they also announced as well that they're discontinuing the step 2 CS, the clinical skills, because of the pandemic. So isn't that kind of, a bit alternating?
I thought about that
too.
I thought about that too.
Yeah.
The thing is that I took my step 2 CS a while back, So I was worried about, are they going to count it? What's going to go on? So the thing is, I think they counted out step 2 CS. Some doctors, it's already listed in CK, you have multiple choice questions in step 2 CK. The questions they ask you are, what are your diagnoses? They're giving you clinical based scenarios in step 3. So what is the purpose of step 2 CS as well? If you're gonna do that anyways in step 3.
Yeah.
You know what I'm trying to say?
Yeah, I know what you're trying to say as well.
Your clinical knowledge is already being put in step 2, and your case-based scenario is being put in step 3.
Okay.
Step 2 CS was just like a midterm way, if people didn't have enough time to take step 3, they would take step 2 CS.
So what you're saying is that step 2 CS didn't have that much of worth if there's step 3 you have to give as well.
Exactly.
Okay.
Yeah.
So, well, there are many people who are going to apply for residency now as well. They've given their step 1 with a score result, and they've also given their step 2 CS. Is it going to affect their chances of getting residency in the States as well?
The chances of residency, look, there are always going to be limited seats for IMGs. Rather than American medical graduates,
Yeah.
Because, like if it's your own country, like let's say you're in Pakistan, it's your own country, obviously you would want people to be medical graduates from that country, but you're obviously going to expand as well. Look for the smartest people out there. So our applications, even if you take, I don't think it's going to vary. Because as IMGs, basically you're looking for as many things to do as you can during that time period. Step 1 and step 2, right? When you were taking these, obviously when you go for an interview, the people ask you, what else have you been doing during that time frame when you were taking the exam? At that time you say, oh, I was doing research, I was doing electives as well. You want to show them that you're the best of the best, the cream of the cream.
You're on the top. That's what you want to top.
You want to compete with AMGs at this point.
Yes.
So this is why, it doesn't matter what your application is. Make sure you're getting those electives. Make sure you're getting those research papers done. It doesn't matter if you're taking step 1 pass or fail, because obviously if the USMLE board is doing that, they have their own reason. They're not going to be like, oh, this guy has a score and this guy has a pass or fail. This guy took step 2 CS and this guy didn't. they're going to look at everyone equally.
Yeah.
But they're going to also look at what else have you done besides taking these exams.
Yeah, all right. So, well, as IMGs, well, as a fellow IMG sitting right here with me,
Right.
it's not going to be easy for you to get a residency in the States. So you're going to have a really, really strong application. So how are you going to make this application? How do you make applications very strong enough so that the USMLE can notice you?
First of all is take step 2. All right. Once you've taken step 2, just take step 1. After that, also take, if you're in your medical school years, I would recommend that I'm sure your medical schools also give you a time period, or maybe they'll give you 4 weeks off or so to take electives.
Yeah.
Use that time period, utilize it very well. Take 2 electives if you have to. Get your name published in research papers.
Yeah.
That happens a lot. In my time frame, they told me at the very last minute, that they weren't even focused on research, There were a couple classes then and there, but there wasn't that much awareness on research papers. And now that I'm getting to this level, now I'm realizing, yeah, I should have been doing more research at that time, Get that stuff done. After that, if you have time, if you want to show you're the best of the best, take step 3.
Okay.
Before you apply. Some people take step 3 after your residency. Some people take it before. People who take it before are just showing their applications to, second year residents or third year residents, chief residents. That I'm here to make it and I'm here to stay.
Yeah, I know. So when you said to make your application strong, you said you should do some researches and some electives as well.
Right.
So when should a ideal IMG international medical student do their research and their electives? In what year should they do it?
Look, you can take research you can start from your first year, second year, third year, but if you want a basic knowledge of your research, I would recommend do it after your second year, Once you have knowledge of basic sciences in your head. If you're doing clinical skills research,
yes,
obviously, when you go for electives, you want to have basic knowledge of that. Wait till you get to third year.
Okay.
In some medical school, I think it is a requirement that you can do electives after your second year. Once you've passed your second year and once you've got to your third year, then you can do your electives. Why do they say that? Because they will teach you first how to properly do history taking. They'll teach you how to diagnose a patient, lab investigations, and all that. And these skills will be also taught to you during electives. So like in IMG, when I went to America, I did some electives over there. I'm going to be honest with you. I didn't know that much at that moment, But I'm glad there were some doctors who were ready to teach me, I'm glad they were supposed to walk me through because the curriculum over there is a bit different than the curriculum you study in a third world country.
Okay.
They will teach you the basic stuff, but you will learn more. And when you're applying for residency, they want to see that do you have experience, prior experience in the US? You can do electives and research in wherever you graduate from, as an IMG. But they want to see that on their standardized guidelines, did you do electives in their country? Do you understand that when you're going to be a resident, do you know what the protocols are? Do you know what the procedures are?
So that's one of the main points that the USMLE is going to look for people who did electives in the United States.
That is a bonus point.
Yeah. Okay.
Everything is a bonus point. Remember that.
Okay.
You don't have to do it, but if you want to have a strong CV, it's a bonus point for you.
Well, okay, since we're both I'm an international medical student in Pakistan,
Right.
and Pakistan, it doesn't have the strongest passport in the world. So for that, we have to go and get a visa to go to the States and do some electives as well. The thing is, not all the time our visa application is going to be accepted. It does get rejected as well.
Right.
So if our visa is rejected and we try to do electives maybe here in Pakistan, does that have any benefit for us getting residency in the United States?
Oh, for sure. I didn't say that it's going to bring you down. I said that everything is a bonus point.
Yeah.
If you're doing electives in Pakistan and you can't get to US, because I've known people from, let's say, Dow University, I've known people from Al Khan University, students.
Yeah.
They've done electives in their prior hospital. They've done electives in their country. And then once they've had a J1 visa or application being, accepted, then they went to the US and did that. There are other programs that will like if you don't have a visa, if you have a Pakistani passport, they'll give you a temporary visiting visa. In that visiting visa, if you are accepted, then you can go for 4 weeks, do your electives, come back.
Okay, so well, if we look into in a scenario in which I am going to apply for the USMLE residency in the United States, and I gave a pass fail, gave you step one pass fail, and I have a step two CK score of about 250. What type of residency would you think would be easier for me to get in the United States?
That depends. I always recommend when people are applying for residency, always go for your first choice. If you are interested in family medicine, 250 is a great number, you know?
Yeah.
Go for family medicine. If you're interested in surgery, it's gonna be a hard application, but yeah, go for that, you know? They might put you in through a preliminary phase and then they might
Yes.
put you through general surgery. It's gonna be a long term. But yeah, look, I've had people who have switched fields of residency in the middle. You
Oh.
know, I've had people who have done family medicine, who have gone to internal medicine, and in the middle, they're like, you know, I want to go into surgery. This is what I feel like. I'm not having that passion for medicine as I had for surgery. They switch half field. Time goes on, you know.
Yeah,
No
man.
one is looking at you. Like every person has their own timeline.
And everyone's just looking at themselves. They don't care what you're gonna do
Exactly.
at
Look
all.
at yourself. Look
Yeah.
for your passion. When you were studying medicine, when you were studying in medical school,
Yeah.
you obviously had a subject in mind that you wanted to go into, right?
Yes.
Go towards that. You know, it doesn't matter how long. Look, I've had people who have had applications like they've taken step two, they've taken step one, and then they've taken numerous they've applied for residency numerous times and they didn't get it. They've done other stuff beside that. They became like a physician assistant. They became a technician, and then when their residency application went through, they went into that field.
Okay. So, well, I've had many people ask me this question, is that when you do get a residency in the United States, do you also get the United States citizenship with you as well?
The thing is, it's different for everyone. I know some hospitals, when they bring in students during their residency, they will
Yeah.
give you that visa, right? That visa will be approved by the hospital as long as you worked with them. And then after that, you can apply for citizenship. You know, if you spend like for more than 4 years, then citizenship will happen. You know, they will give you the application, they will give you the process to go into that citizenship, and you will become a United States citizen afterwards. It's not gonna be like, okay, man, I'm working there. The hospital invited me, and then they're sending me back. It's not gonna be like that because obviously your residency will go on for maybe 3 or 4 years.
Yeah.
And after residency, there will be fellowship
Yeah.
and so on and so forth. Your citizenship will come after you've worked,
Yeah.
right?
Okay. So also that well, some people with a Pakistani passport, when they go to the States with a J1 or H1 visa, and they finish their residency and it's time for their fellowship, what do you think is going to be a promotion process for a person for a doctor with a Pakistani passport? Is it going to be easier for them, or is it going to be difficult for them, and the hospital board is going to choose someone with a U.S. passport over them?
It's not like that at all.
Okay.
But it is very difficult for IMGs. Like I said, it is very difficult if you have a Pakistani passport, because obviously if a hospital is looking at it, they're gonna look at, okay, what is easy accessible to them. You know, if I have a United States citizen
Yeah.
who has studied abroad, obviously I'm gonna hire him. You know, but I'm also gonna look at the other material. Like if I have a Pakistani passport citizen, right? But he has more stuff, he has more experience than that American citizen.
Yeah.
And obviously I'm gonna hire him more than the American citizen,
Yeah.
you know? Every hospital is different. Every hospital has their own guidelines. But I'm not saying, like, don't lose hope, you know? There is, like, I've seen people with different stories. I've seen people with Pakistani passport who have done everything and they get hired instantly. Don't be like, I have a Pakistani passport, but I've done stuff, and that's the only thing that's going to let me down.
Okay.
That doesn't happen.
So, so if someone does get a residency from here, from Pakistan in the United States, well, a big issue for them is that where they're going to reside, where they're going to get their housing as well. So, it's well, it's not going to be easy because some people they get the jobs in like Manhattan, maybe LA as well, where rent's pretty high, and the salaries for residents is not that high at all.
Right.
So do you think the hospital is able to provide you any housing or any housing to help the residents?
Some residents do, because I'm telling you this, like when you go for electives, they will provide you with housing, right? They will provide you what's the closest place to stay, what's gonna be your income.
Yeah.
This is all gonna be provided towards you, and then they're gonna, like any hospital that hires you, either you're a resident or you're a senior, you're a senior doctor over there.
Yeah.
They're gonna provide you a location near you. Obviously, you are gonna have to pay for the place.
Yeah.
They're not gonna be like, oh, come through. We're paying for your stuff. We're paying for everything.
I mean, it's not gonna be free, of course.
Nothing is free. In the
Yeah,
world,
man. We live in a totally different new world now.
Exactly.
That's for sure. So well, when people do get residency as well, some of them choose to work in the research department, want to work in the research department. Mm-hmm. So is it possible for some residents to work in the research department, or is it just mainly they just want to focus on their hospitals just want to focus on their surgery or on their specialty?
So hospitals, what they do is when you've had residency, like I'll be honest with you, my residency hasn't even started yet, but I'm telling you on people's prior experience.
Yeah.
When they hire you for a residency, they're going to make you a rounds, right? They're going to ask you to teach some students. They're going to ask you to, yes, obviously, if you're interested in research, they will provide you with a research department. They will see, this is the doctor working in that research department. Are you interested?
Yeah.
But the main concern is you're getting paid.
Yeah.
You're getting paid by the university hospital to learn and practice.
Okay.
And develop your skills, You've done your stuff from medical school. Now it's the real world life, Patients are going to come to you. They're going to look for your experience. They're going to look for that. Obviously, if you're going to do a great job, you will keep on getting promoted, inshallah.
Yeah. So, okay. Well, I'll come to the final question now. The USMLE. It is one of the most difficult exams ever to take to get residency in the United States. But if you compare to the UK, the P labs, the chances of getting a residency in the UK is much easier than the United States. What do you so would you recommend students to take the USMLE or the P lab if they want to decide it?
The thing is, first of all, decide where you want to go. If you want to settle in the United States, take the USMLE. If you want to settle in UK, take the PLAB. Most people decide on which exam is easier. USMLE is a tough exam.
Yeah.
It's not like it's not passable. I've heard PLAB is way easier, but obviously you have to study for that. Every license exam you have to study. So a lot of IMGs that have gone from Pakistan nowadays are taking PLAB. Why? Because it's more like it's closer to them.
Yes.
It's more like they're having better pay. It's a two-step examination.
Yes.
I'm pretty sure. I'm not that sure, but I've heard it's a.
Oh, you gave the MLEs. You didn't give the P labs.
I don't have prior experience to that. USMLE is a three-step examination. It will take you a long time because obviously, look, half a year you take 6 months. Let's say you take step 1, right? Another 6 months, you take step 2, right?
Yeah.
And then if you want to take step 3, you take that. Some people take a full year. It may take you 2 or 3 years before you apply for residency.
Yeah.
After you've graduated medical school.
Okay. So, well, you've given the steps as well. Out of all that time, during the transition between step 1 and step 2, at any point did you think that you should give up on it?
The thing is, there were a lot of times where I thought oh man, what did I get myself into? When I was studying for step 1, like I said, I was sweating, palpitations. I did not talk to anyone.
Wow.
Because it's so much information. Obviously, we have learned it at medical school, but to apply it now and for looking for details on those questions, that's the other thing I want to talk about. I want to talk about the outline for each examinations. Later on, I'm going to explain that. But yeah, it's not easy, even for step 2. I know that I passed step 1, I'm taking step 2. I'm still panicking. I don't know what to do. There's so much information out there. There's so much videos. There's so much things that are people could to telling you, and you have less amount of time to take it.
Yeah.
Some people are in a time crunch. They want to be like, oh, I want to give it in this certain amount or period of time, but so I can apply for residency. Take it whenever you are comfortable in taking the exam. Like I said before, you are never ready, but you will have an idea when it's time.
Yeah. Okay.
Like I've had the day before my exam, I was like, oh man, should I take this? Should I not? I've already paid for the eligibility period.
Yeah.
I need to take it at one point. Maybe I'll pay for the extension. But then at the moment, I had a senior. He told me that, dude, you're never ready. You've taken all the practice exams. You know your basic score.
Yeah.
Go ahead and take it. You'll be surprised by that. And alhamdulillah, I was surprised. I was surprised by that, like how I took it. And I'm glad because this question will lead me to, I'm going to tell you the process of step 1 and step 2 as well, because students are looking forward to out there. Step 1, remember when you're taking on exam day, you will have a 7-block period, right? That 8-hour block, the 8th hour, is a break time period. You will have 40 questions for each block, 60-minute period, and there will the questions are different. Some block will have 38 questions, some block will have 40 questions, but it's not going to exceed more than that. Once you've started your exam, you can decide when to take your period, when to take your break, okay, I took my first block, I'm going to take a 10-minute break.
Okay.
It's all computerized.
Okay, that's good.
That's the thing, it's all computerized, and that's why I'm kind of I'm pushing forward to that. Always take practice exams so you know the guidelines.
Okay.
Practice exams, why? Because when I took it, the basic advice anyone gave me is that obviously the questions are clinically based.
Yeah.
It's going to be a huge paragraph, and you don't have time to read the whole paragraph. Always look towards the end of the question. What is it asking you? Then look towards the paragraph, check your choices, and it will click with you instantly. It's not going to be what is your diagnosis, right? It's going to be like, what is the mechanism of beta adrenergic blockers?
Yeah.
It's going to have options for that.
Okay, so at first it's going to be a bit simple as well. It's not going to be not all questions
are simple.
Yeah.
They just list it as a big clinical paragraph.
Okay.
The patient comes in, he's this many years old, and then you have lab investigations in between.
Yeah, sure.
Another tip is what I would ask people is always focus. Don't leave behavioral science behind. Do not leave genetics behind. These come in handy. And the way I reviewed these was from BRS as well. They always helped me, and there were a significant amount of questions that asked you about these basic things that people forget, and that's where they stumble upon. Step 2 is a bit different. Step 2 CK is basically you have an 8-hour exam. It's a 9-hour exam basically, right?
Yeah.
8-hour block, and you have it's 1 hour for each block, and you have around 40 questions still.
Okay.
Each one, but these are a bit different. And the other thing is you have a 45-minute break, which you can use anytime, and there's a 15-minute tutorial. Okay. On how to take the exam, All
right.
But during my time, there was an option to see if you wanted to take the tutorial or not.
Okay.
You can use that 50 minutes towards your break time as well. So these questions are a bit different. The resources I used for these were Master the Boards. I used UWorld. UWorld, I am telling you, use UWorld. Go to NBME.
Yeah.
Go to their website. Take as many NBME examinations for step 1 and step 2.
Okay.
These come in handy.
Yeah.
Also take, books I would recommend. First Aid. First Aid's take it for step 2, CK, take it for step 1.
Wait, First Aid was the religious book, right?
That was the religious
Yeah,
book.
okay.
Oh my God, that comes in handy so many times.
Thank God, I'm going to keep that in mind now.
Step 2, CK, I told you, Master the Boards and Step Up were great books. There are different videos out there, If you want to look for flashcards, use, there was for step one, there was like sketchy, pharma, sketchy,
Yeah.
patho. These are basically like picture-based questions. These are amazing flashcards. It helps you retain a lot. Ankai, I did not use it very much, but I also heard it came in handy. If you want to look at, there are different sites as well. Like I did not use Amboss or Osmosis, but I heard nowadays Amboss is coming very handy to people. Like people are loving their medical videos. That is both for step one and step two CK. Other than that, these are like the basic books, because you don't have enough time to read the big books. Because you've already done the big books.
Yeah.
These are the review books that you need to know. And these are very extensive review books that will help you understand your knowledge of what you have already been doing all this time. And when it comes to time frame, like you asked before, yeah, step one, take it, because step one, they're going to allow you to take it after your first 2 years of medical school.
Yeah.
Like we discussed before. Step two CK, I would recommend to take it right after, your once you've done your clinical skills, once you've gone to wards, once you've gone to your once you've handled patient care and all that.
Yeah.
When your third year starts, all the way to your fourth year.
So just take it somewhere around in your final year of medical school.
Yeah, or you can take it after you graduate. I know how much like final year examinations come,
Yeah.
That's very hectic. Take it after your final year examinations. You have time.
Yeah.
Step three is different. Step three is you can either take it before. Once you're done with step two CK, obviously the recommendation is once you've done your step one and step two CK,
Yeah.
then you can take step three. And once you've graduated medical school.
Okay, so you have to take step one and step two so that you can take step three.
Exactly.
But there's no order if you want to take step two or step one.
There's no order between step one and step two.
Yeah.
But for step three, you need to take step one and step two.
Okay. So is there any other advice you would like to give to one of our viewers today?
Today, I would be like, don't lose hope. There was a lot of time where I thought that, yeah, this is going to be it. I don't want to do this anymore, There are a lot of bumps in the road, even in your studying schedule. There's going to be a lot of bumps in your calendars. You can always move that forward, right? Just keep at it, Keep going at it. That's all I have for today,
Okay, well, that's all I wanted to ask you today, Dr. Hamza. Thank you so much for being in this video today with us. If you guys have any other questions or queries, please let us know in the comment section below. Please like this video, share it with your friends, subscribe to Excemymedical, and this is the beginning of our new series, the Excemy Residency series. My name is Munsoor Ahmed Khan. So see you guys later on. Assalamu alaikum.